Dr. Goldberg, at the Glaucoma 360 meeting this year, you presented a talk on the biomarkers and drug delivery. Could you give me an overview of what you presented?
Absolutely. We're making great advances in two fronts on glaucoma. One is, of course, what are the candidate therapies we can give? And today we heard a lot about the intraocular pressure lowering drugs and devices. But of course, I'm very focused on what are the ways that we can treat the optic nerve? What are the ways that we can protect retinal ganglion cells and their axons from dying in this disease? And one of the things that I was happy to share was advances that we're making in the laboratory towards developing new candidate therapies. Equally important and equally exciting, we have to know how to measure the disease. One of the challenges that we face in glaucoma is that it's a slow disease to measure. That makes clinical trials, especially for something like neuroprotection or neuroenhancement, really long, really tough, and really expensive. And so one of the real goals that we're trying to push forward is develop new technologies that let us measure the disease. These are new biomarkers for glaucoma. The Catalyst for a Cure team funded by the Glaucoma Research Foundation has made enormous advances, and one of the things that I really enjoyed talking about today was how pushing forward the biology and the neuroscience, the discovery in the laboratory, and then translating that through engineering approaches into tools that we can use to measure patients' glaucoma and importantly to measure the response to new candidate therapies. Bringing these two together is really the focus of what I spoke about.
You guys made a lot of progress in the last 6 years that I've known this group to be together. And how far along are we before we start seeing things that the clinicians can use in their practice?
Yeah, it's a great question. The timeline from laboratory discovery, engineering prototypes, testing in humans, all the way to something that's packageable, approved by the FDA, and can disperse into the community. Some of the advances that we're going to make, I think advances in imaging technologies that bank on platforms that are already in the community. There are others that are going to start out being focused at, let's say, academic centers or central locations where obviously patients can come and take advantage of the technology even before it's been rolled out in a format that can reach everyone.